Welcome back. Now, it's a Friday, yeah, and we are rushing through the month of August. And as we plan for September, October, November, December, there's some things we need to put in place, especially with regards the health of our families. And yeah, one of the things we need to look into is health insurance. Today, we are joined by Neto Ikpeme, the founder and CEO of Wella Health. Health insurance and how, in quotes, affordable it actually ends up being. Welcome to the show.
Thank you very much. It's a pleasure to be here.
All right. So a lot of, well, I'm going to say Africans are just moving into that space where they understand health insurance. So the understanding is getting there. People are understanding. I think more companies are involving their staff in it, et cetera, et cetera. But what is the crux of it? What is it that people really need to understand, really need to know? They're watching right now. Health insurance, why should I have it?
Yeah, that's a great question. And you're right in that there's a lot more awareness now, especially with companies providing health insurance for your staff. And I think that's great. I think where the challenges are people that don't have a regular job, where they are, say, a trader, they work in the informal sector, you know, they can sometimes struggle to understand, well, why do I have to bother? But the reality is that it's a lot cheaper. Because if you think about it, if you have to wait till when you're sick, there's two things that happen. One is, whenever you're sick, you're trying to minimize what you spend because you hope it will get better. But oftentimes it gets worse and you spend a lot more. And then second is that you think, oh, if I give this money away, then I don't get to use it for something else. But again, the reality is that insurance plans are so much more affordable than they've ever been that you're saving so much when you do buy a plan.
All right. So now the term affordable is relative to status. And I do understand that a lot of insurance companies now have different packages, different things they offer. But what, in your opinion, what is the most important thing that you need to have access to when you have a plan? So, right, for instance, now a family, a man, woman, 2 children, right? What is the most important thing they need to check on every single year?
Yes, great point. So if you look at what people go into healthcare facilities for, a lot of times it's outpatient stuff. So it's things where you you feel a bit unwell, and then, you know, you go into a doctor or clinic, you get some tests and drugs, and you go home. And 60% of those interactions are related to what we would often term malaria. Okay. I say that because it's not necessarily malaria all the time.
We just hear it.
Exactly.
I guess it equals fever these days.
That's correct, yes. So I was going to say that actually it's fever. So when you feel feverish, feel a bit unwell, you say, I'm sick. That is essentially what takes us in. And, you know, a lot of us end up just treating malaria. And maybe it's typhoid. You know?
I've heard that so many times.
Exactly. So that is what, you know, takes us in most of the time, especially if you have little children, for instance. And so, you know, I would say that it's borderline irresponsible to have a family, you know, wife and children, and you don't have a plan for them as far as healthcare goes. Sure. Because children, you know, they will get sick. You know, if your wife will get pregnant, for example, you know, you need those things because it can be expensive to get healthcare.
I was actually going to say that one of the most, the likelihoods for an insurance provider is to provide antenatal care. That's before the baby is born, after the baby is born, vaccinations, etc. And I'm trying to give a compare and contrast. If, for instance, you do have a plan and if you don't have a plan, in terms of percentages, how much more affordable is it for the average family to have a baby with an insurance plan or without one?
Oh, I mean, you can't even compare it.
Okay.
I think the challenge is people wait till they're pregnant before they try to get a plan, which is not really fair. Because the principle of insurance is, you know, you pay when you are well so that when you're sick, you can benefit. And then we have a pool. But if you're waiting till you're sick before you pay for it, then there is no pool to treat everybody. And so a lot of insurance plans will not cover, say, maternity until after a certain time. Because if everybody only bought a plan when they were pregnant, then you can imagine there'll not be enough money to go around because it's so much cheaper. So if you're just going into a hospital to do a C-section, for example, the hospital will bill you so much. If you're just going to do a normal vaginal delivery, again, they'll bill you a lot. And the reason for that is hospitals like to work with insurance companies because insurance companies give them a steady flow of income, right? If they wait for you to just walk in off the street, they're not sure. that you'll ever come back.
Okay.
They'll try to, essentially kind of bill you more than they would ordinarily. But the insurance company is incentivized to try to keep costs low.
Okay.
And they pass that cost savings on to you eventually by giving you premiums you can afford.
All right. So if, for instance, you're getting married right now, you and your wife are planning a wedding, and, people do health checks and all. What sort of plan does, a new couple, what do they look forward to having, pre-pregnancy, as you said?
Yeah, I think that's a great time. Maybe we should start putting on our gift list the health insurance plan.
Okay.
When you're getting married. I think that's a great time, actually, you're doing your health checks. Just have to think about how will we pay for health care if, we do get sick or if we get pregnant, things like that. I know we don't like to think about these things.
Sure.
We say, God forbid, but they happen. We will get sick. People will become unwell. So I think that's a great time to think about it. Different companies have different plans, and we do have to talk about the state's healthcare scheme. There's a lot of push now. Recently, the governor in Lagos State signed an executive order, that mandates that everybody must have a plan, and if you don't, access to public services might not be as readily available. So I think a good place to start, for instance, is a state scheme. It's really affordable. I think it's less than 20,000 naira a year. And that gives you basic access. Yeah,
So if you divide 20,000 by 12 months, that's negligible.
Exactly. It's tiny. That's for an individual. For a family, I think it's probably about 40,000 or thereabouts. So it gives you a sense of how affordable it is. And if you look at, our pockets are getting squeezed. Isn't it nice to say, okay, for healthcare for this year, at least it's sorted. Okay. So the state schemes, they provide really good care.
Right.
Outside of those schemes, private HMOs, it's slightly more expensive, but again, can give you good cover depending on, what you want. So some places can get you into the best and most expensive hospitals. Some other plans, average or mid-sized hospitals. So kind of cut your cloth according to your cloth. Is that what the saying says?
At this point, according to your fabric and the fabric you have these days, but I'm thinking about things like dental, your eye checks, and even a general full health check every year. So I was having a conversation recently where, someone told me they hadn't been for a health check in 4 years. And I said, why? They said, oh, why should they? They're healthy. And this is just, it's just a wake-up call for you. There are a lot of opportunities for you to just, get checked, and a lot of great health insurance plans that are there to make it a lot easier on you if you plan ahead for them.